Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about recent advances in treatment and research in atrial fibrillation. I'm here today with Dr. Sanjaya Gupta, cardiologist at St. Luke's Mid-America Heart Institute. Thanks so much for joining us.
Thanks for having me.
Atrial fibrillation, or AFib, is becoming more common among people in the U.S. The CDC says by the year 2030, more than 12 million Americans are expected to have the heart condition. Left untreated, it can lead to serious health complications. Dr. Gupta, can you explain what is atrial fibrillation and what are the potential health risks if it's not treated?
Sure, good question. So atrial fibrillation, or AFib, is the most common heart rhythm abnormality in the world. Roughly, it affects about 2% of the world population, but the risk of it increases as you get older. So roughly about 10% of people above age 70 or 80 have AFib. The real reason we fear this condition is it substantially increases the risk of both stroke and congestive heart failure.
What are some signs that a person might have AFib, and when is it time to see a doctor?
That's a great question. In reality, it's actually kind of a challenge because people may experience AFib differently. Some people may feel the heart racing, but other people may have no symptoms at all or just have very vague symptoms like just being just a little bit more tired, having decreased stamina. If you notice that these things are consistently changing, that you're definitely more tired and things that you normally would be able to do, you're not able to do, definitely make sure that you go see a doctor and they want to do an EKG or electrocardiogram to see if we can catch if the heart is in a different rhythm or not. Sometimes patients may be actually asked to wear a monitor for a few weeks to try to record their EKG continuously and see if we can catch them having a heart rhythm problem.
Now, can you tell me about some of the latest innovative clinical trials St. Luke's is participating in for the treatment of AFib?
This is a great question. This is really an exciting year for atrial fibrillation. There are several landmark clinical trials that we're really excited to be a part of that are going to really change the landscape of how we treat AFib. One of them that I want to talk to you about is called the Champion trials with a device that we have known for a long time called a Watchman. This is a device that goes inside the heart to seal off a small part of the heart where the blood clots form that actually cause strokes. By having this device placed, a person could have lifelong protection against having a stroke that is the same as taking blood thinners without any of the risks of blood thinners. So that's the real advantage of it. Up till now, we've only been prescribing this device for patients who are at risk for significant bleeding and who could not take blood thinners. What the Champion trial is going to do is ask a different question, is that for anybody who's eligible for blood thinners, is the device better long-term or is the medications better long-term? And we're trying to answer this fundamental question so that we can determine what would be the best strategy for our patients going forward. This could really be a game changer. It may end up, if the device should be better than blood thinner medicines, that people may have that instead of taking medicines for the rest of their life. If they're shown to be equivalent, people would have a choice of which they would want to do. And then if the device is shown to be just slightly worse than the medicines, we'd still have the therapy as we have it now, where it's indicated for people who cannot take the blood thinners.
And what are some other advanced treatments St. Luke's offers?
Well, we offer catheter ablation, which is still one of the mainstays of treatment for people who've tried medicines and still having breakthrough atrial fibrillation. And there's several new trials going out in this next year on new types of ablation that we're really excited to be involved in too. There's also new advances in the diagnosis of atrial fibrillation. There's new devices that people can use to detect at home. A lot has been made about the Apple Watch, but there's other devices as well too. This is a device called an AliveCor Cardia that people can use just by holding their fingers on this. They can take their own EKG at home and their smartphone will actually tell them whether they're in rhythm or not. That's something now that people can just purchase online and can make their own diagnosis, which is so important for people to then be able to diagnose early.
So how do these kind of devices help when you're seeing a lot of patients virtually?
That's a great question. So one of the challenges as we've all gone to kind of a virtual role in this last year is that we can see people on the camera and talk to them, but I can't listen to their heart sounds and I can't do their EKG. So there's now potentially a new solution for that. This is a device called an Echo, and what it is it's an electronic stethoscope that also combines with an EKG monitor, just like the AliveCor is. And so a patient could be at home and could hold this to their chest, and I can listen to their heart sounds and lung sounds, as well as view their EKG. We're actually doing a pilot trial of this at St. Luke's, and we're interested in seeing if this can help us improve care for our patients.
Well, a new study that came out last week found more evidence that high blood pressure can lead to AFib. Is AFib largely preventable?
That's a really great question. So we're learning a lot more in the last year about what some of the risk factors are for atrial fibrillation. So one of the things that we've learned is sleep apnea we know is really important, and that to diagnose and treat it, as well as monitoring your alcohol intake also puts somebody at significant risk for atrial fibrillation if they drink to excess. And the third thing we found out is the important role that untreated high blood pressure has in it. And so all these things are things that now we're starting to finally build a story and understand how people can develop atrial fibrillation, and thereby by taking action ahead of time to prevent these things, we may be able to prevent a lot of atrial fibrillation. So it is exciting that we are now understanding this a little bit better, and also underscores the importance of people seeing their doctor regularly, getting your blood pressure checked, getting an EKG, and trying to stay on top of this.
Well, what's your final takeaway message for people watching today?
I think the biggest thing is for people just to be aware that this is out there, and that if something doesn't feel right, it probably isn't. And not everyone may feel their heart racing, but you can generally tell when something is wrong. When something doesn't feel right with your heart, make sure you go see your doctor, because there may be a sign of something else more serious.
Thank you again, Dr. Gupta, for joining us.
Thanks for having me.
If you'd like to find out more about atrial fibrillation, including information on electrical cardioversion, visit stlukeskc.org/AFib. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.